Good morning, students. In this video, you are going to learn about the levels of prevention in psychiatry. The objectives are students will be able to identify the levels of prevention, appreciate the public health model, define primary and secondary prevention, enumerate the aims of primary prevention, explain the strategies of primary and secondary prevention, and discuss the role of nurse in primary and secondary prevention. Gerald Kaplan, a psychiatrist in 1964, explained levels of prevention of mental illness through primary, secondary, and tertiary prevention. Primary prevention and efforts directed towards reducing the incidence of mental disorder in a community. Secondary prevention refers to decreasing the duration of disorder, and tertiary prevention refers to reducing the level of impairment. This paradigm about the levels of prevention was developed by Bloom in 1979. You can appreciate the illustration about primary, secondary, and tertiary prevention. Primary prevention is started when the person is still having a state of mental health, ability to cope with activities of daily living in an adaptive manner. Primary prevention helps to prevent the occurrence of mental disorders, thereby the health of the individual is maintained and specific protection of vulnerable population is obtained. Secondary prevention is given to those who show early symptoms of mental illness. Here, early diagnosis and prompt treatment is carried out. It helps to regain premorbid level of functioning. In tertiary prevention, it is targeted on those individuals with mental illness who has not fully recovered from it and showing some disability associated with the mental illness. So here it focuses on rehabilitation, which is a process of enabling the individual to return to his near normal level of functioning. This is the public health model given by Gerald Kaplan in 1964. It's a pyramid model. Primary, secondary, and tertiary prevention. Primary prevention focuses on reducing the incidence of mental illness. Secondary prevention focuses on decreasing the duration of illness. And tertiary prevention, it is focused on reducing the level of impairment. Let's discuss the primary prevention. Primary prevention seeks to prevent the occurrence of mental disorders by strengthening individual, family, and group coping abilities. The aim is to reduce the incidence of mental disorder within the population. The target groups are individual and the environment. The strategies carried out: 1. Assisting individual to increase their ability to cope effectively with the stress. Second one, targeting and diminishing harmful forces, that is stressor with the environment. Let's discuss the role of nurse. Individual-centered intervention. The first one is antenatal care and education, promoting regular antenatal care, giving health education on the adverse effects of radiation drugs and prematurity, ensuring timely and efficient obstetrical assistance to guard against the ill effects of anoxia and injury to the newborn at birth, and even having a screening program for metabolic disorders such as phenylketonuria, hypothyroidism, galactosemia, sickle cell disease, cystic fibrosis, toxoplasmosis, etc. Dietary corrections to those infants suffering from metabolic disorders, what I just listed it now. Correction of endocrine disorders such as diabetes, Turner syndrome, tumors. Liberalization of laws regarding termination of pregnancy when it is unwanted, counseling the parents of physically and mentally handicapped children with particular reference to the nature of defects. The parents need to accept and emotionally support the child and satisfied with limited goals in the field of achievement. Fostering bonding behaviors, explaining importance of warmth, accepting intimate relationship, and avoiding the prolonged separation of mother and child. Second one, intervention oriented to the child in the school. First one is to the parents and the teacher, teach about the growth and development. Second one, yearly identification of problems of scholastic performance such as specific reading disorders, which is known as dyslexia, specific spelling disorders, specific arithmetic disorders, and the emotional disturbances among school children and giving timely interventions. And school teachers can be taught to recognize the beginning symptoms of problems and refer for appropriate help, and avoid labeling the child such as idiot, stupid, etc. What are the family-centered intervention to ensure harmonious relationship? First one, consulting with parents about appropriate disciplinary measures, promoting open communication in the families, may it be related to health and even other things, and see that a good emotional climate is maintained. Crisis counseling to parents of physically and mentally handicapped children, because for sure the parents have so much of emotional disturbances, low self-esteem, things like that, and even to the level of not accepting the child, and so uh, they need counseling related to how to tackle this situation. Ensuring harmonious relationship among family members and teaching adoptive techniques. The interventions oriented to keep families intact. Mental health education related to child rearing practices, trial relationship between teacher, child, and parent, integration of mental health into general health practices, strengthening social support, especially for people at home, those who are very elderly, promoting educational services in the field of mental health and mental hygiene, developing parent-teacher association, rendering homemaker services. For example, if the homemaker of the house is absent or not able to carry out her work due to reasons or health reasons, so make arrangements like somebody replaces that place so that that work is carried on, and marital counseling for those with marital problems. Interventions for families in crisis during the developmental crisis, uh, such as during adolescent period, birth of new baby, and retirement during menopausal time, death of a loved one, or the death of the breadwinner of the house, divorce, separation, and crisis intervention can be given at mental hygiene clinics, psychiatric first aid centers, and walk-in clinics. Mental health education, conduction of mass health education through film shows, flashcards, appropriate AV aids, and related to prevention of mental illness and promotion of mental health, educating the health workers. Then the society-centered preventive measures, concentrating on culturally deprived families also, and the community development programs are carried out, like biological and psychosocial supplies are given, hygienic living conditions are taken care of, like the basic good water supply, good sanitation, good food, good environment, ventilation, etc. Secondary prevention. Secondary prevention targets people who show early symptoms of mental health disruption but regain premorbid level of functioning through aggressive treatment. Targets: recognition of symptoms and provision of referral for treatment, ongoing assessment of individuals at high risk for illness during home visit and during daycare or community health care. Role of nurse: early diagnosis and case finding. Under this, health education also is important, and giving health education to the community leaders, industrialists and Mahila Mandals and Balwadis, etc., detecting early signs of mental illness, and the community mental health nurse detects the early signs of like increased level of anxiety, decreased ability to cope with stress and failure, even people who have attempted suicide. So this will enable her to help patients not to, attempt suicide another time. Instead, helping the patient to have a wish to live in this world. So that is a very important role of the nurse here. And early reference and screening programs, like a simple questionnaire can be, prepared to assess the early symptoms of mental illness, which can be given even at schools, and training of health personnels and consultation services. Nurses working in government hospitals, they come across patients with puerperal psychosis, anxiety states, peptic ulcer, ulcerative colitis, bronchial asthma. So take measures and see that these patients are referred to the right place at the right time. Then crisis intervention by providing correct cognitive perception about that situations, like assessment of the situation and defining the event to identify the predisposing event and develop a plan of action for the individual. And second one, help uh, the individual to be aware of the feelings and help the individual to attain a mastery over the feelings. That's very important. And assist the individual to manage the intense, overwhelming feelings associated with the crisis. And there are certain techniques used, like catharsis, clarification, and manipulation, increasing self-esteem, exploration, like finding alternative ways to manage the problems. So these are the crisis intervention measures which can be used in order to help the patients to, uh, get cured from that particular, get relief from the particular situation, or get cured with prompt treatment and early diagnosis and prompt treatment from the disorders.